So let's talk about ultrasound-guided peripheral IVs. I'm Kat Ogle, Assistant Professor of Emergency Medicine. By the end of this talk, you should be able to describe the ultrasound-guided procedure to a patient. You should be able to apply the bountiful ultrasound knowledge that you have to a systematic approach, and you should be able to follow recommended safety practices. Ultimately, this is an invasive procedure, so you should get informed consent, even if it's verbal informed consent. This requires you to explain the procedure to the patient, make sure they are clear about the indications and contraindications, and make sure you also discuss the risks, benefits, and alternatives to the procedure. Ultimately, you must respect the patient's autonomy. If they do not wish to have the procedure, they do not have to have the procedure, but they should understand the risks, benefits, and alternatives. For invasive procedures, we tend to use the linear or high-frequency probe. It provides tremendous detail, and whenever we're doing procedural ultrasound in the transverse plane, you, as the proceduralist, will want to have the probe marker oriented to your left. This is so that if there's a structure on the screen that is to your left, you'll simply slide your probe to the left to center it. There are multiple different ultrasound machines which you will come into contact throughout your career. It is important that you're able to identify the key adjustments on each machine because all of your ultrasound machines have the same functionality. With regard to depth, you're going to adjust the depth so that the structure of interest, i.e. your blood vessel, is in the center of the screen, or the structure of interest is taking up 2/3 to 3/4 of your screen. Your blood vessel should be centered between the left and the right, and also from the top to the bottom. Gain is another adjustment that you'll need to make to the machine, and the gain should be adjusted so that the blood vessels are anechoic. And on each of these images, the gain adjustment is highlighted in red. Color flow is a way in which you can differentiate between arteries and veins, and the red marker on each of these images actually shows you where you will find that setting on the machine. You should know that color flow specifically will assess the direction of flow, not whether something is arterial or venous. So if blood is moving away from the probe, it will be blue, and if blood is moving toward the probe, it will be red. With arteries and veins, when flow is moving toward the probe, it will be red, and when flow is moving away from the probe, it will be blue. As you can see here also, arteries will have thicker walls, will be less compressible, and will have pulsatile flow. Your veins will be thin-walled, easily compressible, and non-pulsatile. When it comes to determining which vein you should use, you want to make sure that you're using shallow vessels, which are easily cannulated by your catheter. You want to also try to find a bifurcation and make sure you're using a tourniquet. For probe manipulation, there's multiple different ways to move your probe, and we'll talk about them. You can see in this video that the probe will actually move in multiple different planes. I think it's important when you're doing ultrasound to make sure that you're only moving in one plane at a time. So this is left-right sliding. This is rocking anterior-posterior. And then this is sliding anterior-posterior. And this is fanning left to right. You can also compress. And finally, you can rotate. This gives you a good visual estimate of what happens when you are going to be sliding anterior and posterior. You see the blood vessel is circular underneath the probe. And then as you slide left to right, you see the different shapes of the tubes on the screen. Compression is one of the ways we're going to differentiate between arteries and veins. And you can see when you compress here that the tube in the center squishes. This is a live image of blood vessels, and you can see both veins, arteries, and nerves. You want to try to avoid nerves whenever possible. Here you can also see the pulsatile flow of the artery in the center when they compress. One other movement that may come in handy is rocking the probe. And this is when you move it in the plane of the ultrasound beam. You will also need to apply rotation to move into the longitudinal plane of your blood vessel. So you can see here it transitions from circular to tubular. And finally, these guys talk about tilting, which we use the term fanning. This is just moving the probe anterior and posterior. Here's a live action image of some blood vessels. There are actually 4 blood vessels here and 1 nerve. This is the artery, moving around there. And then the 3 compressible vessels are the veins. And then the honeycomb-looking structure is the nerve. You want to try to avoid those again when you're doing an ultrasound-guided IV. So when it comes to collecting your equipment for the procedure, it's going to require everything that you would normally use for an IV. And the only additional thing that you're adding is an additional tegaderm and ultrasound gel. You also want to make sure that you wash your hands before laying hands on your standardized patient. And before you do the invasive part of your procedure, you want to make sure you put your gloves on. So the first thing we're going to do is we're just going to look at your arm to see if we can find the best vein. Okay, so there's the tourniquet. I'm going to smack this up real smack. Does that feel okay? Mm-hmm. Just relax your arm. You're going to feel a little bit of cold jelly. Going to make some modifications on the machine so I can see everything. Okay. Oh, good. So, found a nice big artery right next to 2 veins. If you're curious, that's what it looks like. Okay. The ones that are kind of squishing down, those are compressible. Those are veins, and then the arteries right here in the middle. So I can prove that it's an artery just by doing this color portion on the machine. See how it's popping up like that? So that shows me that that's the artery. And make a fist for me a couple times. Good. So then when you make a fist, I get a little bit of flow in the veins.
And that's how you know the difference?
Mm-hmm. Yeah. So you'll need to make sure that you track your needle closely and confirm it in both the transverse and longitudinal planes. So to summarize the steps to this point, once your needle is confirmed inside the blood vessel in both the transverse and the longitudinal plane, you can put the probe down. Next, you want to advance the catheter fully inside the vessel. Make sure you extend it all the way until the hub is flush with the skin. Take your tourniquet off. Attach your extension tubing. Flush the catheter and make sure that there's no swelling or pain for your patient. Wipe off all of the gel and hold on to your ultrasound-guided IV very carefully because this is the step in which most of your ultrasound-guided IVs get accidentally pulled out. Next, you want to apply your tegaderm and tape to secure it in place. Dispose of all of your sharps. And then finally, you're going to document the procedure. And remember, the purpose of documenting the procedure is helping everybody who's taking care of the patient understand where you are and to also provide a legal record of the procedure. So I'm just going to put the tourniquet back on and clean the area. You can see everything else. So here's the vein. So see both the top and the bottom of the vein. Get your needle ready. Alright. Mr. Blue, you're going to feel a little pinch here. We'll give you a 1, 2, 3.
Okay.
Alright. 1, 2, 3, big pinch. Almost there. Okay. We're very close to being finished. I just need to make sure I see the needle in both directions. That looks good.